Hi, thank you for tuning in to globaleliteacademy.com. We're going to talk about IHSS patients for New Mexico. Now, in each state is called something different. It might not be called IHSS in New Mexico, but it's the program is comparable to IHSS. IHSS was formed in California. So the system in New Mexico is called MI Visa self-directed waivery. This is the closest equivalent to IHSS. It allows the client to have control over their case. They receive a Medicaid budget. They can hire their own caregivers, including family. Services are provided in the home. And this is for non-medical services. Now, if you can also go to a home health agency as well, and you can also a home health agency. You can either, in other words, there's two programs. One where you hire for yourself, and the other if you go to an agency and have them put in get people for you. So it's the IHSL self-directed care. That's the clients. You hire your own caregivers. Or you have the community benefits. It's called community benefits, where the agency provide caregivers. Okay, so those are the two programs that you have. And you can also get, disabled, but we're going to stick to where you would go and get this as a company. Okay, so what do you need to start enrolling in a Medicare waiver program, which is a community-based program? In New Mexico, you all have a whole different ball game where you all can do, and you could get a lot of patients. Okay, so you're first going to enroll with the state Medicare program that's sponsored by New Mexico Healthcare Authorities. They have a provider enrollment portal, and I will have that information placed on this in the notes part of this audio, telling you where to go. When you go to the portal, you're going to create a provider's account. Then you're going to submit an enrollment application, upload the document, and get your Medicare provider number. Documents usually they require is your registration, your EIN letter from the IRS, your liability insurance, the NPI number, which is the National Providers Identification Number, your W-9 form, a background check, and owner's information. I'm sure they'll tell you what all they want you to upload, but this is some of the general stuff that they will ask you to upload. Now, you want to get your NPI number. It is required first. Before enrolling, you must get your NPI number. I'll give you the address and everything where you would go and apply for that number. The number is issued at the Center for Medicare and Medicaid Service. Most agencies may take 1 to 2 days to get it. All right. Now, after you do that, then you're going to connect with the Turquoise Care health plan. New Mexico operates through the managed care system called Turquoise Care. After you receive your Medicaid provider's number, you must contract with the Medicare health plan that sends clients, which is in New Mexico is Presbyterian health plan, Blue Cross Blue Shield of New Mexico, and Molina Healthcare of New Mexico. Each plan has a provider contract page where you submit your provider's application, Medicare provider number, insurance, W-9, and self-description. Once approved, they begin referring clients needed for personal care service. Programs that send home care clients. Most agencies receive clients through community-based program and then the self-directed waiver where I told you about. Both are part of the New Mexico Home Care and Community-Based Program. So again, step by step, you're going to get the MPI number, apply at New Mexico's Medicare Provider Portal, receive the Medicaid Provider ID, apply to the Turquoise Care health plan, and start receiving Medicare home care referrals. Now, I was looking through something, and it said that in New Mexico, because of this referral with the health management, the insurance, your company can turn into a $1 million company because of those large referrals. I have not seen so far any state program, the home community base, that signs up with these particular healthcare insurance plans. And so since I'm now just seeing this for New Mexico, it really makes me curious if they're doing this in other states. This IHSS was, like something new. So maybe they didn't do it before, but now they're doing it now. But wow, that's a really great thing to have. So it says this Turquoise Care, almost every Medicare client is assigned to a care coordinator, which is a case manager. When a client needs personal care at home, that coordinator refers them to an agency. And then it's the three agencies, the three places I told you about. And they say that this is the main referral pipeline for New Mexico. The biggest source of referrals is the case management system. That is really great. Okay, so I'm going to put all this in the information on this, in the notes on this video, so that you can know where to go and, and apply. Wow, it says, so it says that how does the agencies actually get the referrals? You contract with the Medicaid health plan, which is that what I just told you to do, or you market directly to the care coordinators, or you build a relationship with the hospital discharging planner. That's very difficult to do, so forget about that one. But the other two sound more plausible. And plus, if you're going to be on their website, your name is going to be on there anyway, so they'll be able to refer clients to you. I haven't seen where you can get these many referrals, and they're actually saying that you could turn your company into $1 million company. This is great. Again, if you have any questions and you want us to help you, I'll put our number in the box below and for notes, and you can contact us, and we'll help you with any portion of this that you need. Usually you're going to need, you're definitely going to need the policy and procedure manual, because when you apply for your provider's certification, they want to make sure there's rules and regulations that you're going to have to follow. So they want to make sure that you have this. So the policy and procedure manual that we give you is 9 binders. It has the first 8 binders is how you're running your agency. And the 9th binder is how you're running the portion of your Medicaid wanting a Medicare portion of your business. And so it's going to end up being like 9 separate binders. And those policy and procedure manuals cost anywhere from $2,500 to $3,000. And we will help you put it together. We'll put everything together for you. It's ready to go. We could either mail it out to you in the binders, which we don't usually do, or we could put it on a disc, or we could just download the information, send the information to you, and you just download it immediately. But either way it goes, you have to have these policy and procedure manuals. Now, they sell them all over the internet, but the problem is, are you getting the correct ones? Because sometimes when you see some that cost $200, I can tell you right now, they are not the updated ones. The updated policy and procedures are definitely going to cost you $2,000 to $3,000. And it's $2,000 for the binders 1 through 8. And then it's usually an additional $1,000 for binder 9. And binder 9 is for the Medicare portion. So, so if you need help just with the binders, give us a call. Again, I'm going to put my number in the box, and we can help you with that. If you need help with the agency, we do have a do-it-yourself program where we walk you through it step by step, and you can take that class to, everything is online, what you would need. Or you can apply for our mentor. Our mentorship, somebody is with you every step of the way, helping you do everything you need to do to be a successful non-medical home care agency. And you could go online and look at that program, or both of the programs, the do-it-yourself program, and then the other program too is online. Or you could give us a call and we'll walk you through both programs and telling you the amount that they are and whatever information you have. Okay? So this sounds like a winner in New Mexico. It is, like I said, usually Blue Cross and all of that, they don't usually, it's no way to get to them to get, for home care agencies, especially for Medicaid, Medicare. They just didn't even take it. And so now it's telling you, wow, you could go and apply at their page, and then they'll refer patients to you. And then each agency, can build their agency to be $1 million agency just off the Medicare patients. That is fantastic. So, like I said, I haven't heard of this portion of it just in New Mexico. So I'm going to check now to see, if that can be done in other states as well. Okay, thank you so much for tuning in, and you have a great week. Bye-bye.